If we talk about pathogenesis of tertiary hyperparathyroidism, there is increased in patients after renal transplantation. So patients who undergo renal transplantation, they are prone to develop tertiary hyperparathyroidism. Patients having secondary hyperparathyroidism, having increased parathyroid hormone level, they also can have tertiary hyperparathyroidism. Long-term hypocalcemia, hyperplastic parathyroid gland fails to resolve. So if there are hyperplastic parathyroid gland and this is not coming back to normal, if they are fail to resolve, then it can cause tertiary hyperparathyroidism. And then hyperplasia of all four parathyroid gland is another condition that can cause the tertiary hyperparathyroidism.